I got bad allergies with pollen.
Okay, so nothing crazy then.
No, sir, I don't have no crazy cough.
Good. Then I don't need to test you.
Really?
Whatever way that it comes won't get the better of me. I've got it under control.
Okay, it's Friday, April 3rd, and let's get straight to our news updates. Local news. Okay, so for cases in the United States yesterday, 228,000. Now, 265,000. 506. Significant increase. Deaths, 5,369 midday Thursday. Today is Friday. In one day, about 5,400. Now, 6,786. So that went up about 1,400 deaths in one day. That number is increasing by the day. More deaths. We will expect this to continue to rise. Very, very sad. For Marion County, cases yesterday 33. Now for today, Friday, as of noon today, 34. So they found one additional case. We have done in this county so far, and this is probably even a little bit lagged, but 988 tests have been done in Marion County so far. That number is a good bit higher because that may not include every single lab, and so it's hard to keep completely current information on what the true number of patients tested is. Still 150 plus tests pending for our county, and we want that number to continue to grow. Okay, so Trinity Clinic is a donation site. We have received a significant number of donations so far, mostly our own employees. We have a number of things to donate to the local homeless community, so we're very happy about that. Also, we are on the search for face masks and face shields and any other PPE equipment. So to remind everybody, we are a donation site for the COVID-19 response. Straight to COVID-19 testing sites for Marion County. This list remains unchanged from yesterday. Trinity Clinic is a testing site. We have more kits rolling in by the day. Rainbow River Medical doing testing, Heart of Florida Marion Oaks. Langley Health Department, Express Care Bellevue, Lakeview Medical, and Premier Medical. If anybody knows of any testing sites in our community that we don't yet have listed here, please comment or message us and let us know so we can keep this list completely up to date. Thank you for that. And as another reminder, the Trinity Clinic COVID-19 Response Ambassador Group on Facebook is live and up and running. We've already had a number of people join that group, and we're hoping to grow that number. Please get with Debbie Flanagan. She's leading that group. We invite everybody to join. We are looking for the people and the businesses that are doing good things in the community. We're searching for the people and businesses that are in need so we can get members of our group to reach out and help. We're looking for good news, and if we can't find good news, we're going to create good news right here in Marion County. Straight to our Flatten the Curve for Marion. So just to remind everybody, each line is 1 day of time. This is the number of hospital beds. The approximate capacity for Marion County hospital beds is around 1,100 plus or minus. Still looking for firm numbers on that. So an unchanged number of COVID cases admitted from yesterday. So our second day line will look just about the same as our first day line. Very good. So now we have 2 days. This is April 2nd, and then next line April 3rd. This is the remaining capacity that we have for hospital beds in our county, and we do not want to continue letting this increase and approach capacity. So we want to keep admissions low. We do that by isolating. We do that by distancing. We do that by early testing and getting people symptomatic isolated. So this officially begins day one of Florida's 30-day stay-at-home order. The way the healthcare community in our county should be looking at this is the clock is set. We have a 30-day timer now to find and isolate as many positive COVID cases as we can, and that is our efforts here and will be the efforts of the local healthcare community as well. We're extremely excited that we have found a lab based in Texas that can ship as many test kits as we can possibly need with as little as a 36-hour turnaround time, which is significantly better than the LabCorp, Quest, and health department CDC kits that the community has been using. So we have already reached out to the local health department to let them know that this lab is available, and we're going to see if we can get thousands of kits shipped right here to our county. We will keep you closely posted on that because that is a major development for our area. So we did 5 COVID tests for today. We're well over 50 now for our watch list and PUI list. Still waiting on some results to come in. This was a good Friday, a fun Friday. We got a lot done. We're going to be ready to gear up for a strong week next week. Roll tape for Friday's action. Good morning. When did PUI 5 come in?
Check the wall this morning.
Oh, that's what you were going to say?
Yeah, we haven't called her.
So we're completely HIPAA respectful of the entire process that we're documenting. PUI number 5 is in. Are we going to check for maybe number 7, 8, and 9? No, they're not here?
Nope.
Okay, maybe we'll look a little later today. We might get another result or 2 or 3 back. It'd be nice to call them before the weekend, but we're checking on the weekend too.
She's been calling. She's like, I saw that 6 was up. Why aren't mine up? So we'll get to her as soon as we can.
Oh, her?
Yeah.
She saw that this was up,
Yeah,
and she's like, "Where's
I was
mine?"
Number 5.
Okay.
Where's mine? And
Hopefully
I don't know
she's
why
doing
hers
better
was
too.
delayed like 2 days after his.
Okay, so we have at least 4 or maybe 5 swabs for this morning. This is what we want: testing, testing, testing. Hey, when did you go to the beach for 2 weeks from yesterday?
I didn't. It's fake, and I forgot about my damn in between
Oh,
my fingers.
wow, that's a really good fake tanner.
Jordan helped me pick it out. We sat there at Walgreens.
That's a really
like,
good
just
fake
looking
tanner.
at it. I spent like $40 on my fake tanner. This was $20, and I still have more than half.
I thought
the
like
can left.
this girl's been at the beach for 2 weeks
I know.
from
Well, I mean,
from
I
yesterday.
am pretty sunburnt from like chilling in the kiddie pool drinking White Claws.
What's a White Claw?
Cut that out. Cut it out. Don't drink White Claws, kids.
He has a dry cough, headache. He's very fatigued. He had chills and a fever, which kind of went down a little bit, but it was 100.4. Body aches, shortness of breath, he noticed because he sings, and he was trying to read a book to his kids, and he caught himself having to break.
Yep.
And he currently has no chest pain.
Is that that's the 5th one she wanted to add on for the day?
Yeah.
Okay, let's add him.
Let's add him?
Yeah.
Okay.
Let's add him. Let's test him.
We added 15 people, putting us at 34. One more
Watch
this
list.
morning. Yes.
15 more on the watch list from yesterday.
Putting us at 34. One more this morning. 35.
35 for the watch list, and we're going to be up to PUI 19 or 20 by the end of this
We
day.
have 19 with the 4 we have now. If we add the one more, 20. Yes.
And so we're going to be tracking, we're up to like 55 people then, roughly?
Yes.
55
And
people.
it sounds like she's on the phone with another watch list, so.
Okay. So you're sick, right?
The funny thing is, I woke up this morning, I checked my temp. I have no temp anymore. My body doesn't hurt. I don't have a migraine. I honestly feel pretty good this morning.
No kidding,
So I
huh?
don't know if I just had the regular flu for a couple of days.
Yeah.
And I'm over it now.
All right, any cough, any respiratory symptoms, anything like that at this point?
Just mucus, but I got bad allergies with pollen.
Okay, so nothing crazy then.
No, sir, I don't have no crazy cough.
Good. Then I don't need to test you.
Really?
Yeah, I don't need to test you. A lot of people are scared. You know that, right? A lot of people are scared about what's going
Yeah.
on. So if it's okay, I'd like to leave you on our watch list, though. I'd like the girls to continue to have a check-in with you day to day,
Okay.
just until we know you're about a full week out, clear of symptoms, I'm feeling great. Are you okay with that?
Yeah,
Yeah.
that's fine.
Good. I'm not going to bill you or anything for today. If you like, I give you gas money for your drive over.
No.
Okay. I'm just going to document what we had to talk about. I'm glad you're feeling better. Honestly, I'm glad.
Me too.
In our county, you know, we've done a test on 1,000 people, and we only have 33 positives out of 1,000 tests we've done.
It's a lot of tests wasted.
Well said. Well said. Okay. We are not testing today. His symptoms are much improved overnight. He has no fever, he has no cough, so we are not going to test him. We'll go ahead and get ready for the next one. Yeah,
Let's just stay like this, because the minute
if I could just get you to stand out in the sun and wait for the next one in your gear, that'd be...
get that vitamin D.
Yeah. We're happy not to have to test.
Yeah, we are.
We will save kits for the most essential people. Very good. Yes, Tatiana, you have a question.
Yes, so we had a patient called yesterday, and I noticed that Suze had gave me This was the same patient. She called this morning. She's shaky, fatigue, body ache, shortness of breath. She can't get air to even talk. But when I spoke with her yesterday, she mentioned that she coughed up mucus and she saw blood in her mucus.
Isn't there a medical word for that?
Hemoptysis.
Hemoptysis. She's having hemoptysis.
Okay.
Are we going to test? Is she having fevers?
Yeah, she called
How
this
high?
morning. Let me see if she specified. She did not specify.
So what are we?
She didn't. She just said it started on Monday.
Was she watch listed, or did we just
She
hear?
was watch listed.
She's been on the watch list.
Yes.
And she's worsening.
Yes. She called this morning. She woke up at 4 a.m. shaky, fatigue, body aches, and she couldn't even talk because she was out of breath.
How old is she?
I don't know.
What do you want to do?
She's worsening. I say test her.
I concur.
Beautiful.
When are we going to do that? Let me know her age first. Wonder if she can make it through the weekend and we can get her on for Monday.
Okay.
Yeah, let me know what her risk factors are.
Okay.
So we've got a lot of action happening this morning. The call volume is increasing and we're looking for people to test. This increased call volume is, I'm gonna need help, you know? I'm gonna need to hire somebody else. I need to go talk to my business manager. Hey Deb, you know, we're getting really busy, so I think I need to hire about 5 more people. Do we have enough money to do that? We don't. You think we should start a GoFundMe or something? Practical, reserved. That's a good kind of business manager right there. There we go. So fashionable. It's so 2020.
Yellow is absolutely our color.
It's so
2020.
So 2020.
Hey, I like your jacket in pandemic yellow.
Added 37 people.
37 people on our watch list, but we should be getting people that are better.
Yeah, the ones in green are better, and we got to call the rest still. We haven't had a chance to call today.
No worries, we'll have some time this afternoon to work on it some. And then we still don't have any results from PUI 7 forward. Last we looked earlier today.
This is someone donating supplies. Hello? Alrighty, I'll be right out, okay?
Love to take some donations. Oh, you're gonna be on camera now.
Awesome.
Yeah.
These are washcloths. It's like a pack of them.
Oh, that's awesome.
Yeah, and
Yeah.
packages. Yes,
thought those would
thank
work.
you.
So good.
Yes, thank you.
This is awesome. Look at this, Jordan.
All right.
Heroes, heroes,
There's
heroes.
actually,
So here you go, glove. Wow, I can't believe you found. You can't believe you found this stuff.
Walmart.
Walmart. No kidding.
Did you go in the morning?
You're so generous.
That's why.
You have to go in the morning.
You have to go
That's
in
the
the
only way
morning.
you're gonna find
I
stuff.
just found that
And I'm
out.
gonna look for more toilet paper and bring that too.
If we weren't isolating, we'd all hug you right now.
Yes.
Air hugs.
Thank you. This is what it looks like, everybody. We need donations. Thank you. See you, Missy. Look at this.
Yeah, amazing. Yeah, I was like, these are perfect.
I saw this, I was like, I'm grabbing every
Yeah.
single powder for like, moist areas.
Fantastic.
So we just need body wash.
Yeah, body
That's the
wash.
big-
What is it? We're gonna do body wash, socks, like plain like white t-shirts.
Okay.
I'm thinking. Like,
Hey, Deb, did we give everybody raises or something? Spending all their own money on this?
No.
Wait.
And then we got some donations too
Yeah,
from some
we
people
did
that
get
saw the
our
video.
yeah, for us.
Are we gonna get a hold of Interfaith and let them
I'm
know what we're...
are we doing intercom? I was gonna call Dennis Yance
Oh yeah, okay,
and
sure.
let him know, because he's working with everybody.
okay.
And he works with also on the street. Interfaith and Salvation Army were more in the shelter. So
Well, maybe get him a picture of
I'm
Yeah,
gonna
this
that's
get
so
the
he
new
can
picture.
see.
I had one, but now I'm gonna get the other
Yeah.
stuff too.
We can open
Okay,
them
so
like this.
we're accepting donations not only for PPE material for the medical community, but also our local homeless community is in desperate need for just basic human supplies, soap and deodorant, toothbrushes, and feminine products.
Big feminine products.
This is a really good first day. And so we're gonna make sure we get all this over to the Interfaith and Brothers Keeper and anybody else that can use it. Good work, team. Good work, community. Yeah.
She said, good morning. We
Who?
are starting,
Who did?
Diane from Interfaith.
Okay, Interfaith, yeah.
We are starting to check temps this morning. What should we be wearing on our faces? Surgical N95 or face shield. We will document everyone as well as we screen starting high-risk clients first. Thank you. So I sent her a video, a clip that JP and Shirley did. I said,
Smart.
good morning, so glad to hear that. I will send you a short clip of some gear you can put on to protect yourself and your team. Recommended a gown, mask, N95 if possible, and gloves.
And to try to maintain as much distance as they're able to maintain, not get crowds together, you know. So great. So I'm glad to hear that the homeless are being attended to about this as well. If she finds anybody, then she's going to let us know.
We're keeping in contact,
Yep.
Alrighty.
Beautiful. People helping people. We can. I know that we want to unburden the emergency rooms as much as possible, right? You know what we discovered is that because of the lack of good local updates on kind of what's happening behind the scenes, everybody's just reading the national news, and the national news is terrifying. That if we can keep our focus local, because we can only control local, right? We can't control what's happening in New York City right now. We can't control what's happening in Louisiana or Washington State, but we can control Marion County and what's happening here and our mitigation efforts. We're on a 1-month stay-at-home order now, officially today, right?
Yeah.
And that means that me and you as a hospital and all the other clinics and hospitals in the area have 1 month, kind of like a countdown. We have 1 month to get as much testing as we can get done, to get as many people isolated as we can, and to stop this thing in its tracks right here in our county.
We have kids, I think.
We think, we
I
don't.
wanted to be just as surprised as you.
Oh, well, let's hope it's kits then. That's the kit face.
I would say that's the kid face.
Oh, that's more LabCorp.
Yeah.
We were expecting these?
Yeah, remember I told you I put in the order?
This is amazing news. So this puts us up to what, like
I don't even know anymore.
60, 70 kits or something, and then we got something else coming.
Yeah.
All right,
I got additional.
we are ready to test at Trinity Clinic. More coming.
So
I want to see the test kit dance, Shirley. Yeah.
I can't.
Sorry.
What
Sorry. So we have lots of LabCorp. We just got Quest kits in over here, so we have a pretty good supply of kits now at this point. And we still have the Viker scientific kits for the Medicare straight people.
Right.
And now we have yet another lab where we can get a significant supply. So tell me about this lab.
AIT Laboratory.
Yes.
They're a full infectious disease lab based out of Texas. It was actually one of the viewers off of Facebook that gave you a lead.
Oh, we got somebody, this is from somebody on Facebook.
Yes.
Awesome.
So I reached out to her. It ended up being the local rep who's in Orlando. Her name is Kendall. Thank you, Kendall.
Yeah, is she gonna watch?
She is now. So I talked to her, got us set up. She is going to ship us 50 kits.
50 kits.
50 kits.
What's the limit for ordering for kits?
There currently is no limit because they are fully stocked. And she said if we run through these 50.
Will you call her and ask if the local hospitals want to get 1,000 kits? Okay, this is a significant lead. Will you call her and ask her the most that they'll send in one shipment to
Absolutely.
the 2 different hospitals that we have in our area?
Yeah.
Hey, Kendall?
Hi, Dr. King. How are you?
Oh, I'm outstanding. I just want to let you know that you're live on our TV show.
What?
Yeah, just want to let you know that... What?
Don't pull my chain now.
Yeah, so, don't like swear and say like, or anything like that, okay?
Okay, I'll make sure I keep it really cool, like super PC, okay?
Now, you're with a company called AIT Laboratories, that's right?
That's correct.
And you are sending us some kits, which is awesome, and we very much appreciate that. You know the testing kit problems that the country is having. And we're not a hot spot in our area yet, but we have a very high-risk population with, the villages, obviously, right here in our county. So our hospitals have been looking for ways to increase the volume of testing. So on behalf of the hospitals in Marion County and Ocala, how many kits do you think your bosses would be willing to ship to us if I present this to the local hospitals and the health department?
Well, I will tell you as many tests as you need. So if you guys are looking to set up like a drive-through type of situation, we're working with tons of drive-throughs throughout the entire country.
Wow.
And so we are more than happy. I mean, we're dedicating like all of our resources right now to COVID-19 and the pandemic.
Unbelievable. And the turnaround time, they said, was 36 hours once you received the specimen?
Yeah, we say 24 to 48 hours. It'll get to you before 48. You have, and especially in Ocala and the villages, you're at a very high-risk population.
Holy cow. All right, I have some calls I need to make now that I've spoken to you. What was your name again?
Kendall. My name's Kendall.
Oh, Kendall, I'm glad to know you. All right, I appreciate you. Thank you.
All right. You're welcome.
Wow, that's an amazing lead. Hey, give me a high five. Boom! So this is potentially big news for our county. So let me let the health department know what information we just found, hot off the press. I want to close out this Friday with just this one thing that I read here this week. Pretty powerful statement from a doctor who makes an excellent point about what's really happening with this COVID response. Here's what it says. We, the healthcare workers, are not your frontliners any longer. We are your last line of defense. You, my fellow people, are the frontliners now. The war is shifted to the community, and it's up to you. This cannot be won in the confines of the hospital. What that means is by the time that hospitals are full and reaching capacity like they are in New York City and other places, the battle is already lost at that point. This battle will be won with the community efforts that we're making here today. So I cannot stress enough to all of you as we begin day one of our 30-day stay-at-home order. Now is the time for all of us to rally together. Everybody have a safe weekend. We'll talk to you next week.
Half on solid ground, half on sinking sand. One side looking up, one side caving in. Full of endless light, full of endless